And you know how much food you eat? You eat the amount of food you want to eat. But the amount of food you want is the right amount for you now. You got that? Yeah. All right, so the secret here to great health and your ideal weight is achieving micronutrient adequacy so you get back in touch with true hunger, okay? Let's look at Emily, okay? Emily is a woman who lost 100 pounds in 1 year. You know, it wasn't that she lost 100 pounds. That's very important. But she struggled her whole life with severe food addictions. And she'll tell you. She said the food addictions affected my relationship with my children, with my husband. I couldn't join them on camping trips. I couldn't do fun things with them. I had young children. I was literally tied to the house in bad health. She was depressed. She had frequent sinus infections. She had breathing problems and shortness of breath. She had a poor quality of life. Now, look at her. She looks 20 years younger. And you know, if you could see the pictures real closely, you'll see her skin. The color of her skin, the wrinkles of her face, her eyes that are now holding out. It looks like her mother, the way she looked a couple of years ago, right? Yeah. Let's look at one more person for a minute, okay? Scott. Because Scott lost over 300 pounds. I think he's lost about 330 pounds. It's a lot of weight. He was over 500 pounds. And you know, when Scott lost, at 500 pounds, trying various diets, having cravings and addictions, if you say to Scott, how come all those diets never worked for you? He'll say, because I kept trying to lose weight, and now I'm focused on my health first. And you know what Scott said? It's all about achieving great health, and the weight loss followed effortlessly, and without even trying to get it off. And you know what? He thought he lost all the weight he needed to lose when he got to be 195 pounds. He thought he was at the most favorable weight. He said, look, I've gotten all the weight off. And I said, well, you never know, Scott. Just keep living your life. And now he's 175 pounds, right? He lost another 20 pounds. He wasn't trying to lose more weight. He was just happy with that first, 300 pounds he lost. These are people just like you and me. They're people with the same struggles living ordinary lives, finding it difficult to live on American food because we've learned the wrong information. We've been confused about good health. Don't you want to be fit and stay fit as you get older? Don't you want to be excited about life? Healthy, right? Really healthy? Free of pain, without the need for medications and all their side effects? Fully living for the years you are living? That's incredible health, right? Look, I'm a board-certified physician, and I've worked in emergency rooms. And clearly, medical care is valuable for emergency situations. But if people are falling off a cliff, we don't want to just have ambulances waiting at the bottom to pick them up. We need to put a fence at the top of the cliff to keep them from falling off, right? We want to get rid of people, stop people from falling. And your weight, it's not just about the cosmetic issue. It's not losing weight to look good. Of course, that'll happen. But you have to lose all that disease-causing fat to have a low risk of disease, to have a fun, pleasurable, healthy life. It's all part and parcel. So write this down. This is very important. I want you to write down, the salad is the main dish. I want you to write down the salad is the main dish. I want you to put that right on your refrigerator. Put it up there. The salad is the main dish. So every time you go open the refrigerator, every time you walk by the kitchen, you see the sign, the salad is the main dish. I want you to have a large salad every day. And you know what? I want you to have some seeds and nuts with your salad. Because when you eat a little healthy fat from seeds and nuts, with the salad, you increase the absorption of those phytochemicals and anti-cancer nutrients tenfold more nutrient absorption when you eat a little fat with the salad. So you don't want to snack on nuts. You want to eat it with the meal. Preferably, even make a salad dressing out of them. Let me give you an example, right? I'll take a peeled orange or some orange juice, put it in the blender, throw a handful of raw cashews in, some lightly toasted sesame seeds, maybe a little blood orange vinegar or rice vinegar, maybe a squeeze of lemon in there. Whip it up, churn the blender, make it smooth and creamy. Pour it on a nice, delicious salad, maybe a little strawberries or kiwis in with tomatoes and red onion. Delicious salad. This tastes good. Even the dressing tastes so good, you can eat the dressing with a spoon practically. And the dressing is healthy. The dressing protects you against disease as well as the salad. What most people do, they'll put like 3 tablespoons of oil on top with a lot of salt in it and 120 calories a tablespoon. They'll put 390 calories of dressing on 30 calories of vegetables, right? I'll say, then forget the salad. Just drink the dressing straight from the bottle. But clearly, this is an exciting way to eat. This is a nutrient-rich diet style. It's not a diet. It puts an end to dieting forever. It's just simple science. And you know what? It's not only science, because we have to consider that we make judgments based on emotions and feelings, not just science and logic. The smoker, they know they should quit smoking. They know it's bad for them, but they don't in some cases, right? Because the primitive part of the brain is saying to them, oh, it's too stressful to quit right now. My son got in a car accident. My husband might be losing his job. I've got stress in my life. I've got this problem. I've got that problem. But you know what? Your life is so much more stressful and difficult to deal with and difficult to solve the problems in your life when you don't have your health. You have to get rid of your addictions. You have to take back control of your life. And there's a few days of getting rid of food addictions and feeling worse, yes. But it's worth it, because your whole life after that, food tastes better. You feel better, right? I know. Some of you may think, you may be listening to me out there and you may be saying, you know what, that sounds great, it's really exciting, but that's not for me, you know? It is for you. It's not that hard. It sounds different. Trying to eat more superfoods, trying to eat, instead of dieting, we're trying to eat larger amounts of these high nutrient-rich superfoods. We're going to make them taste delicious. Instead of trying to eat less, it's all about trying to eat more. Take away, to get you back in touch with true hunger, make eating taste great, make you feel great. You're going to feel full. You're not going to be hungry, right? You're going to eat as much as you desire now, right? But here, you have to consider this, that a diet made of nutrient-rich, disease-fighting food, it doesn't have to be boring. It can be made to taste delicious. And I've created incredible recipes, and I have people, the best chefs all over the country, incredible world-class chefs wanting to help out because they're excited about this just like you are. And people from all walks of life are doing this now. So the thing here is that you can lose radical amounts of weight without dieting, never gain it back. You can enjoy eating and enjoy life more, enjoy great fitness and great health, and maintain your youthful vigor into your golden years. And this is not a fad or a quick weight loss scheme. It's not about extreme exercise and extreme dieting that can't be maintained. This is something, once you learn about it, you keep it with you forever. It stays in your mind forever. It can never get rid of you. You can never get it out of your mind. It's a knowledge-based program. The knowledge that can set you free from chronic disease, can set you free from dependency on doctors and drugs and invasive surgeries. It can put you back in control of your health destiny. This is for you guys. I know everybody in America needs to know about this. So after the break, we'll come back and I'm going to discuss how you can put this into action, how you don't have to have a heart attack, like all your friends and neighbors. Enough is enough. Enough is, let's win the war against these tragic illnesses right now. Okay?
Good.
Thank you, thank you. Earlier we learned step 2 of my 3 steps to incredible health, how to eliminate food addictions through proper nutrition. I told you about the difference between toxic hunger and true hunger, and how once you get rid of your food addictions, weight will just melt off you. And now I'm going to tell you about step 3, superfoods for health and pleasure. Now, our nation has spent billions and billions of dollars on cancer research looking for a magic pill, and we've nothing to show for it, right? We've hardly put a dent in reducing cancer deaths. But we can win the war on cancer. We can win the war on cancer right now because the answers are right in your local grocery stores and your kitchens. And you can choose these foods that arm your body with heightened defenses against cancer. And these same properties in these superfoods cause you to achieve an ideal weight. Heart disease and diabetes also are easy to prevent and reverse, right? I have so many examples and so much evidence from me and doctors like me who can reverse heart disease with their patients. I mean, just look at this slide. This slide was cut and pasted from the American Heart Association website. It shows that heart attacks in America 100 years ago hardly even existed. Yet today, it's the leading cause of death in America. Let's consider Julia for a minute. Unfortunately, Julia had 3 heart attacks in 1 year. 3 heart attacks in 1 year. that seems like whatever the doctors did, they couldn't stop it from happening. She was literally sent home to die, and she couldn't leave her house. She couldn't walk more than, from the bedroom right to the bathroom. She couldn't move around that much without having pain. And of course, she was on multiple medications, all the medications she could be on. She was on more than 10 different medications. When she came to me as a patient, she was hopeless. Julia didn't just lose 105 pounds, she got rid of her heart disease. It melted away with proper nutrition, just melted away. This is years ago. She goes to the gym, she goes to exercise class, she shops, she takes care of herself. She got her life back. This high nutrient eating style that I'm teaching you today, that's been in the medical literature, in the medical studies, right? The scientific studies. This was published in the medical journal Metabolism that showed that this way of eating lowers cholesterol more than cholesterol-lowering drugs. You see, but when you lower your cholesterol with superior nutrition, you drop your blood pressure simultaneously without medication. You drop your weight. You increase your ability to be active and exercise. You perfuse your body with all these protective nutrients that reduce inflammation. And inflammation is a big part of the causation chain of heart disease and clots that cause heart attacks, right? It stabilizes the heart and makes it not have arrhythmias. Drugs and surgery are not the answer. A matter of fact, I call those medications that the doctors write on their prescription pads, I call it a permission pad. Because the minute a person has that medication, they have the subconscious now permission. They can just go and live the lifestyle that caused the problem to begin with. They don't even think they have any personal responsibility. The doctor's just taking care of it. We think our savior for good health is to get more doctors and get more drugs, right? You're going in the wrong direction here, The meta-analysis, meaning the large studies that pool together all the information on, let's say, high blood pressure medications, it shows that the blood pressure medications lower the top number, called the systolic number, but it also, as it does that, it pushes the lower number too low. And as you get older, a lower diastolic is linked to irregular heartbeat and sudden cardiac death. It prevents the blood from getting back to the heart because the diastolic blood pressure gets too low as you put the systolic back in the normal range. The medications are not the answer, right? We need to tell people, sure, medications may lower your risk a little bit, but they're not going to protect you. You want real protection? You have to change the way you eat. Nutritional excellence imparts super immunity. You don't have sinus infections. You get a viral infection, you bounce out of it in a day, or you don't get sick at all. You have headaches all the time, you don't have your headaches. Breathing, asthma, so prone to allergies, fatigued all the time. Who wants to be sick all the time? Who wants to live your life being dependent on doctors and a whole medicine cabinet full of toxic drugs that make you feel sick? You got to take advantage of this modern science to get incredible health. You only get one life, you only get one body, you don't get another one when you blow it. Protection against cancer, against heart attacks, is related to your weight. And here's the relation. The most powerful anti-cancer foods induce weight loss. You see, a properly fueled body is a miraculous self-healing machine. Let me give you some examples, okay? The studies on mushrooms and onions and berries and green vegetables show dramatic protection against cancer. And this is recorded in the scientific literature. Medical journals like the International Journal of Cancer, like the American Journal of Clinical Nutrition. There was a study done recently, about a year ago, published in the International Journal of Cancer, on mushrooms. And they found that women who consumed mushrooms on a regular basis had 64% lower risk of breast cancer. How much mushrooms was that? It wasn't that much. It was 10 grams of mushrooms a day, and 10 grams of mushrooms a day is only like one mushroom. Like one white mushroom is 10 grams a day. Don't you think that information should be on the front page of the New York Times? Time magazine? But there's something more here. Because in that same study, they found that the women who ate in the highest quartile of mushroom consumption, the highest amount of mushroom, which was about 10 grams a day, if that group of women who were eating green vegetables simultaneously, like green tea or green vegetables with it, had an 89% reduction in breast cancer. That's just from eating green vegetables and mushrooms.